to a lot of events, and not one is quite like this. There's a great spirit here. It's a little bit halfway in between a wedding and a roast. Right. And based on that photo I saw of Tom Bacon, I think you are the first dance. Anyway, it's great being here, and I appreciate Maggie and the foundation inviting me, and thanks to the Bernstein family, and I appreciate your words about Glenn, who is the founding chair of one of my departments, social medicine, and it's really wonderful to be here. And they've given me about 20-25 minutes to say everything I know about the Affordable Care Act. I think I can probably do it in about 3, and then we can turn it back over here for some more emceeing. So let's get going. All right, so I want to start at the beginning, or at least one of the beginnings here, and talk about what we have learned so far from the implementation of health reform in the last year. And of course, before it even got going, it ran into some pretty big trouble, and cartoonists usually have a better way of summarizing this than political scientists do, and this cartoon is evidence of that. But you'll remember back before the exchanges or marketplaces even got off the ground, well, they didn't really get off the ground initially, but before they went supposedly off the ground, a bunch of folks got letters in the mail in North Carolina and other states telling them that their policies had been canceled. Thank you very much, because they didn't meet the new regulations, and they weren't compliant with the Affordable Care Act. And that caused a big political furor, and eventually the administration had to back down and make some allowances and enable states to extend those policies if they wanted to. And the question is, what can we take away from that episode that drew so much attention last year? And when I look for inspiration for trying to interpret things, I generally look to movies. So I'm going to try this out on you right here. I think this is a little dangerous because I got to be honest here and say that I actually haven't read not a single Harry Potter book. Never mind. Maybe I should have said that. You say they shut the bar at 8, we might have extended it. Health reformers' dream, I think, I've seen the movies, does that count? Health reformers' dream is to be like Harry Potter. It's to have a wand and come up with a health reform plan that makes every man, woman, and child in this country better off in their health care, or feel like they're better off. But our friend over here on the other side, Colonel Jessup, would tell us the truth of the matter is that's impossible. There is no health reform plan that will make every single person in this country better off, or at least feel like they're better off. It doesn't exist. And the Affordable Care Act was passed partly on the theory that you should leave as many people where they are in their health insurance. For better or worse, you should leave them there for political reasons, because the less you disrupt the system, the more of a chance you had to pass health reform. Well, that was a pretty good political theory. After all, they passed it. But it turns out that implementing that theory is a lot harder. And the reason is, by its nature, reform is disruptive. That's what reform means. If you're just going to leave everything in its place, you don't have to change anything. And as much as they took pains not to disrupt the system, there was going to be that disruption. And so when they changed the rules and it affected the individual insurance market, a market that I think most health policy analysts would tell you is expensive and inefficient and unfair and punishes a lot of folks for no reason other than they have a medical condition. When they took that market and they changed the rules, the smallest part really of the US system, about 5% of Americans got their coverage that way, you saw how much trouble they had. And part of the reason for that is because we believed in the Harry Potter fairy tale, that we could wave that wand and get everything right, and that's just not the case. Not everybody is going to feel like they're better off. So before they got started, they had trouble. Then we went on to the marketplaces, and of course the marketplaces were originally called the health insurance exchanges. The problem with that is that sounded like a coffee shop on Franklin Street. Nobody really knew what an exchange was, and it ran into so much political trouble they had to rename it. And if you gave former Secretary Sebelius truth serum, and maybe because she's former secretary, you wouldn't have to right now, and you asked her, did you, in your wildest dreams, ever think that about 3/4 of the states weren't going to set up their own marketplace, their own exchange? The Obama administration would tell you no. They never imagined that the federal government would be running entirely or helping to run these marketplaces in so many states. And look how polarized the implementation of health reform was on this issue. And what I think is important to understand about that is there is probably nothing in the Affordable Care Act that was more popular than the idea of a health insurance exchange. Back in 2009, about 87% of Americans said they liked this idea. It's hard to beat 87% of Americans on anything, let alone on healthcare. Democrats, of course, liked it and had embraced it as a way to regulate insurance companies and to expand coverage. Conservatives liked it because, after all, this is about competition and choice and private insurance, so it had bipartisan support. If you read, for example, Paul Ryan's healthcare plan back in 2009, and since this is Chapel Hill, I know a lot of you have. So if you read Paul Ryan's health plan back in 2009, you would see that he had an exchange. Virtually every major healthcare plan or alternative had something like this, some way to pool the uninsured and bring that purchasing power together. And when the law was passed, the feeling was, well, almost all the states are going to set this up because the Affordable Care Act said to the states, you set this up, and if you don't do it, Washington will come in and do it for you. And a lot of people thought, well, those states that don't like Obamacare very much, they don't want Washington running this for them. They're going to do it themselves. It didn't work out that way. It didn't work out that way, and it set a pattern that we have seen in the implementation of health reform, a pattern of polarization that I'm going to come back to. All right, now when the exchanges first started, it was the answer to the proverbial question: what would happen if you threw a health reform party and nobody showed up? Because they couldn't get the invitation, or at least couldn't get in the door. And so when healthcare.gov went online, it was a disaster. It was a disaster, and there are a lot of reasons for that. A lot of reasons you can give, but ultimately, I think it's inexcusable. If you've got a health reform plan that's known after your own name, you better make sure when it goes live that it works. That would be a good rule of life to follow. And when this went online, you had journalists running around North Carolina and the rest of the country trying to find anybody who had signed up for coverage in those first 4, 6, 8 weeks. And it was hard to find anybody who had gotten through. They tell me you don't get a second chance to make a first impression. This was not a good first impression. And there are a lot of folks justifiably so worried about it. But over time, the numbers picked up. And you can see, I don't know if I've got a laser pointer. I'm going to show you a state laser pointer right here. Okay. So, gotta make two. Okay. So if we just look here at the top line, which is the red line is the federal enrollment, and the greenish line is in the state-run marketplace. If we just look at the top black line, you'll see over time, like I said, it started out slow, but over time picked up to the point where they actually hit and exceeded enrollment targets. And given the slow start that it had, that's a pretty remarkable achievement. And so by the end of the process, certainly wasn't perfect, but healthcare.gov is up and running pretty good. Now, this is a chart looking at states and how they did in terms of, this is data from the Kaiser Family Foundation, in terms of potential enrollees, folks who were uninsured, as well as people in the individual market. And you can see the number over there in the left-hand column, and then the percentage who signed up. And the big news, first of all, about this is North Carolina did really well. It did really well. We punched way past our weight. If you look down there to Georgia, Georgia, I think, has got a population pretty similar to ours, and we did really well. And if you compare North Carolina to other states that didn't set up their own marketplaces, we look even better, and we're up there, and it's a testament to the hard work that a lot of people did across the state, and a lot of people in this room, and a testament, I think, to the spirit that Jim embodied, and that Glenn embodied, and that Tom embodies, and that is that commitment to make North Carolina that moves on health reform, and you can see it. And people would call me, and they would ask me, they'd say, why is North Carolina doing so well? Why are they doing better than Georgia? And I would tell them it's because we know how to use computers more than they do. But I don't have any evidence for that. But so now that's the good news, and it's true. It's true that North Carolina has done really well, and we should applaud that. We should be proud. But I don't want us to get too far ahead of ourselves. And I'm going to tell you a story about back when I was a freshman at the University of North Carolina, sometime in the middle of the 1980s. And I lived in a dormitory called Hinton James. Anybody here live in Hinton James? Oh my goodness, it's a big dorm. So Hinton James, if you're driving down Manning Drive and you see a bunch of things that look like they should be projects in New York, that's the dorm right there. Hinton James, one of the least attractive structures ever built at this university, and one of the furthest away, by the way, to get to anything. But I was there, when I got there as a freshman, I didn't know how to cook anything. And I blame it on my parents, but I didn't know how to cook anything at all. And I lived in a suite with a bunch of other guys, and nobody knew how to cook anything in the suite, except for one guy. One guy could cook something. And he knew how to make pasta. And so he could get the water and put it in the Dutch oven, and he could boil that water, and he could take the pasta out of the box and pour it in said boiling water, and he could cook it and then drain it in the colander, and we thought he was Julia Child. Because in a suite full of people who can't cook dinner, somebody who can make pasta is a culinary god. Well, before we get too far ahead of ourselves and too self-satisfied of North Carolina, take a look at the percentage of eligible enrollees that we signed up. About 1 out of every 3. So North Carolina looks good, and there's reason to be proud, but part of the reason we look good is because the other folks can't cook pasta, because the other states did so badly. So we've got a long, long way to go in North Carolina, as do other states. Okay, speaking of a long way to go, so back in the summer of 2012, when the Supreme Court made its ruling saying that the Affordable Care Act and its individual mandate was constitutional, they also said that the Medicaid expansion in the law was unconstitutional and unduly coercive of the states. And they effectively made Medicaid expansion a state option. And a lot of people, just like with the exchanges, a lot of the conventional wisdom in health policy said, look, the federal government's going to pay 100% of the cost the first few years. In perpetuity, 90%, which is better than the deal the states get now. The states are going to pick this up. It's going to be so overwhelming, they're going to pick this up. And as with many things in health policy, that conventional wisdom didn't turn out either. And we've got a situation now where about 24 states still have not expanded Medicaid, and of course we're sitting in one of them, and I'll get to that in a little bit. I want you to do a mental exercise for me, mainly because I didn't have time to make this slide up, so I'm going to cheat a little bit, which is, if you take the electoral map of 2012 between Barack Obama and Mitt Romney, I want you to superimpose it on this chart right here. Now, it is not exact, but it's close. It's close. If you knew no other fact, but which candidate won the presidential election in that state in 2012, you can predict what most of the states did. And the fact that we're having this debate over Medicaid is another sign of the polarization, the partisan polarization of American health policy. It is not just healthcare policy that is polarized. This is a chart that some political scientists did and is used a lot. And what they did, apparently they had a lot of time on their hands because they counted every single vote from the 1870s all the way to the present. And they, political scientists don't have lives. This is the kind of thing we do. So what they did is they coded those votes according to liberal and conservative, and let me go back to my pointer here. What it's showing you to the top and the right is conservative, down here is liberal on this scale, down below. And so what it's showing you, if you take a look, say, at in the 1950s, you'll see there is a big difference between Republicans and Democrats. This is in the House. A big difference ideologically, but it wasn't huge. And if you took Republicans and Southern Democrats, of course, not a surprise, was not nearly as large. Now look what has happened the last 3 decades to political parties. They always say that the reason that nothing gets done in Washington is people don't hang around and get drinks together anymore. And I don't know. I used to live in Washington and had plenty of drinks, and I didn't get a lot done. So I'm not sure that's true. But what I can tell you has happened in Congress is we have had a polarization of the two parties. They are further apart ideologically, Democrats and Republicans in Congress right now, than at any point since the 1870s. And we have just fought the Civil War, so yeah. So they are far apart, and that you see that on a lot of issues, and you see it in healthcare, and you've seen it in these debates. So let me come back to North Carolina now. I was talking with a friend who lives in England, and I was telling him about healthcare reform and how it was playing out in North Carolina, and I was telling him about the issue we're having with Medicaid expansion, and the fact that there are a lot of folks that were too poor to qualify for help. And he didn't understand that, and I said, well, that's just because you're European, you don't get it. You got to come over here and we'll set you straight on how to organize a healthcare system. Leave that English behind. Anyway, the fact that we've got this situation where people are too poor to qualify is a crazy situation. And think about the inequity here. Somebody who's making $40,000 in Chapel Hill can get a subsidy right now to go buy health insurance through healthcare.gov. Somebody who makes $8,000 who wasn't already eligible for Medicaid, they're not eligible for anything. And that is a situation in our state and the other states that have not expanded Medicaid. It's hard to come to terms with. Hubert Humphrey, a long time ago, talked about what the moral test of government is. And the moral test of government, as Humphrey said, is how you treat the most vulnerable. And I want to be as clear about this as I can be. The state of North Carolina and the government of the state of North Carolina has failed that test. We've got about 300,000 to 400,000 low-income North Carolinians making below the federal poverty line. Some of our most vulnerable citizens who we could give health insurance to and have it paid for by the federal government, and we've chosen to turn our backs on them. And they are paying the price. And there's not a day that should go by where we don't remember that and don't remind folks in Raleigh about the cost of this. Now, this is not just a moral issue, it's an economic issue, because we've got a natural experiment going on right now in the country, since we've got about half the states expanding Medicaid and half the states who aren't. And PricewaterhouseCoopers came out with a report a little while ago and said they were looking at healthcare systems that operated in both kind of states. And what they found, not surprisingly, is the systems that are operating in states that expanded Medicaid are doing a lot better than the systems operating in states that have not expanded Medicaid. So this is not just a moral issue, it's an economic issue. It is a decision that is hurting the hospitals in this state, that is hurting the healthcare providers in this state. We know that when you expand Medicaid coverage and you give low-income people insurance, they have more money left over to go out and buy things. So it's a decision that fails on a lot of ways. Now, I am a hopeful person. I'm a glass half full person, and maybe there's reason to be hopeful because there have been some smoke signals coming down from I-40 recently that maybe, just maybe, the state's getting ready to change. This is, we should remember, not a permanent decision. My guess is, over time, more and more states, as Pennsylvania did recently, are going to climb on board with Medicaid expansion for that economic imperative, because their hospitals are going to go to them and say, look, we get it, you don't like Obamacare, but let me tell you something. If you do not do this expansion, you are going to kill the hospitals in this state. All right, so what we've got here is two Americas, and you can see this is a survey by the Urban Institute showing that overall we have lowered the uninsured rate, and we estimate probably in between 8 to 10 million Americans have picked up insurance coverage since this went online. But you can see if you compare the states that have expanded Medicaid at the bottom, the states that haven't expanded Medicaid, we're going in two opposite directions in the country. We've got a real divergence here. And if you look at where the uninsured are now, right before this started, the uninsured were evenly distributed. Most of the uninsured in the United States are living in states like North Carolina, like my home state of Florida, like Texas, that haven't expanded Medicaid. That's where they are. So again, two Americas. Regardless of you're in a state that expanded Medicaid or a state that didn't, there's, as I said before, a lot of work left to be done. And one of the problems we have with the Affordable Care Act is nobody understands the Affordable Care Act other than Pam Silberman, I think. But that's about it. And a lot of folks, you've got to, as this is showing, a lot of people who could benefit from it haven't even heard that they could benefit from it. If 4 years after you pass the law, a good percentage of the folks haven't heard that they can get subsidies, you've got a problem. And so we've got a lot of work left to do in enrollment. Okay, let me talk real briefly here about healthcare spending. And don't pay attention to the different colored lines, but just look at the overall trend. And you know, there's some good and surprising news, which is healthcare spending has been slowing down. And it's been a sustained slowdown and gone on far past, I think, what most of us thought would happen here. And that's the reason I say that's good news. It means in the long run, Medicare is less expensive, Medicaid is less expensive, the Affordable Care Act is less expensive, premiums are less expensive for businesses and their workers. So this is good news. Now the question is, how long is it going to last? The answer is we don't know. So that's an easy one to answer. The harder question is, why is it happening? And there are a lot of theories, and I can tell you, having read a lot of the work on this and talked to some of the people who have worked on it, that the answer to why we have had the sustained healthcare slowdown ultimately is we don't know. But we've got a lot of ideas. A lot of this is probably the economy and the historic economic collapse we had. That's part of it. Some people think that it may have something to do with the spread of high deductible plans in the private sector. Some people think it may have something to do with changes in payment and delivery reform. Some people point to some of the changes Medicare has made in what it pays, and it's hard to disentangle all that. To what extent is the Affordable Care Act responsible for this? Well, it depends if you believe in time travel or not, because the slowdown started before the Affordable Care Act was passed. So if you believe in time travel, then Obamacare could have gone back in time, slowed down healthcare spending, and come right back to the present to get enacted. If you don't believe in time travel, then the answer is it's probably not, for the most part, the Affordable Care Act. Is it playing a role now? Maybe. But it's hard to say, and we'll have to see what happens in coming years. But regardless, there's no question that it's good news. All right, so let me turn to the future. I like talking about the future because unless you are a time traveler, there's nobody here who can prove me wrong. Okay, so what do we got going on? We have an enrollment period. It feels like we just came out of the last enrollment period, doesn't it? And we're sort of burned out and sick of it, and here it is again, coming right upon us. And right before Thanksgiving and the holidays, which is a nice touch, I think that'll make Thanksgiving dinner a lot better for folks. So we've got that going on. We have some limited data on insurers and what their premiums are going to be. And of course, that's a big question. We got a lot of people we want to sign up. It depends a lot on what those premiums are going to be in year 2. And the data that we have so far suggests that the premium increases on average are pretty reasonable, pretty good. So that's good news, but we don't have all those in, and it's going to vary by plan, by state, by area. So the mandates, the secret about the individual mandate is if you look at some of the survey research and focus groups that's done on this, one of the most powerful elements of the law that got people to sign up was the penalty. And you say, well, why would people sign up when the penalty is so low, first year, $95 or 1% of income? And part of it is because Americans are law-abiding. Evidence in this room to the contrary, but Americans are a law-abiding society, so a lot of people saw that. And for other people, they say, well, if I'm going to lose money to the government, I might as well get something back. So even modest penalties can have a big effect. The problem is the penalty is one of the least popular dimensions of the law, and so the administration and others understandably haven't been leading with that. But as we go into year 2, and we got a lot of the easy pickings, the people who really wanted coverage in year 1, the penalty is going to go up, and the administration and others are going to be faced with this dilemma, how much do you talk about the penalty in year 2, because we want to get a bunch of folks to sign up. Employer mandate. The employer mandate is a part of the law that's been politically troubled from the start, and the Obama administration has, citing a little-known constitutional authority called political desperation, delayed the employer mandate several times over, and it's set to go in effect again, but it's taken on water. There are a lot of folks who are allied with the administration who are talking about jettisoning it. It's another part of the law that's unpopular in some quarters, and so it'll be interesting to see how that plays out. We, of course, know, if you've been watching TV and had your football interrupted, that we've got elections coming up. How much could they change? Well, I'm not sure how much they could change other than if you do get a unified Republican majority in the House, Republican majority in the Senate up in Washington, there's no question that they will try to overturn the law. However, President Obama still being President Obama, that's not going to happen. So you'll see some fights on particular issues. Maybe they'll go after what I would call targeted repeal and go after some things that maybe some Democrats don't like the medical device tax, but probably won't have a huge effect except to make our budgeting process even more partisan and acrimonious, and won't that be a good thing? The legal challenges to the law are not over. This was a little-known fact about the Affordable Care Act, is it was actually passed because lawyers needed employment, and so there are just endless legal challenges, and one of the most interesting is one challenging the legality of folks getting subsidies in states like North Carolina, where there are federally run exchanges, because they merged 2 versions of the law, and it was late at night, and they forgot to put that in explicitly. So this is something to keep your eye on that's going through the courts. The year that I think really matters is 2017, and there are a lot of ways to view the Affordable Care Act and the future of Obamacare. Some people say, look, it's too late, there's too much water on the bridge, you're never going back. And I think there's truth to that. I do not believe status quo ante is an option. Too much has changed. We're not going back to 2009. We're not getting rid of kids getting coverage on their family's plan up to age 26 and a bunch of other things. That's not happening. And every time somebody else enrolls in Medicaid or enrolls in the exchanges, the root deepens, and it's going to be harder to uproot it. It's going to be harder and harder and harder to uproot it. So I think there's a lot of truth to that. On the other hand, look how much trouble the Obama administration has had trying to make this law work. And they want to make it work. Sometimes it's hard to tell, but they want to make it work, and look how much trouble they have had. Now imagine an administration that doesn't want the law to work, but wants it to fail. A full-scale repeal in 2017, could that happen? I don't think so. But could you have a situation where you had an administration that wanted to weaken the law, that could weaken parts of the law and use waivers and other mechanisms, and Congress, again, going after targeted parts of the law? I do think that's possible. And all you have to do is to think about this politically, is imagine the presidential primary cycle that's almost upon us. And if you're running as a Republican candidate for president, I don't think you're going to win that nomination by getting up there during a debate and saying, hey, we hate Obamacare, but it's too late. I don't think we can repeal it anymore. I don't think you're going to hear Ted Cruz or Jeb Bush or Chris Christie or anybody else say that. So if there's a Republican president in 2017, they will try and repeal it, and I think this fight isn't quite over yet. That's my own view, that even though we can't go back status quo ante, I don't think the fight is all the way over, so we've got some interesting times. As I said, I'm a glass half full person, so for all the problems we've had in implementation and all the issues that are upon us, I'm still optimistic. I used to, before I got into healthcare policy, this wasn't in the introduction, so I didn't tell anybody, but before I got into healthcare policy, I used to study Middle Eastern politics. So for me, this is like nothing. This is Irvada. I may have to go back to that after tonight, but I am an optimist, and in all the years, I took my first class from Joel Schwartz at UNC in 1987 in healthcare. And for all the 2+ decades that I've been studying it, no question in my mind that this is the most exciting time, the most interesting time, the most compelling time, and I also think the most hopeful time, and I hope that North Carolina will make good on that promise. Thank you very much.